I see really as two different categories. One would be a category where a doctor or a healthcare provider is actively engaged in the practice of medicine with that patient, being attentive, being responsive, making decisions that they think are correct in the real moment of time, and ultimately make a wrong decision or sometimes even a bad decision. There's a level of malpractice that has to do with that issue. Then there's a whole separate category of malpractice that has to do when a physician is not those things, is not attentive, is not responsive, is derelict in their duty, maybe impaired on duty, maybe on call and doesn't show up, maybe decides to delegate a responsibility to someone else who's not really qualified or capable, and that doctor knows that but doesn't want to be inconvenienced by having to assess a patient. That's a different type of negligence to me. So when I look at negligence, I look at it in those two ways. I see negligence as either a physician is there, is trying to take care of the patient, but makes a bad decision, a negligent decision, one that a reasonable doctor would not make. And that's one level of negligence. To me, those cases are a little harder because most juries understand doctors are human and don't expect perfection from the physician. And what the defendant always does in those cases, the lawyer for the defense, is they say, the doctor was there, he had his hands on the patient, he was trying to do what was right. Medicine is an art. Sometimes some people go left, sometimes some people go right. Doesn't necessarily mean he was negligent. He was trying to take care of her. Turned out going left was really not a good thing to do in this case. But at the moment, with the information that he had, he made the best decision he could, and he was making the best decision he thought he was making, he made for the patient. Now, that is a more difficult hurdle legally to overcome on the plaintiff's side. If, on the other hand, you have a physician that is not attentive or does something that is so outside the bounds, well, then that's a different kind of negligence. I see medical negligence in two categories, some of which falls into this failure to do the right thing, but all the intent to do the right thing was there, versus another category of negligence where there was just never an intent to do the right thing.